I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of Holistic Integration, where lives are changed every day through the natural approach to healthcare. Well, today we're going to talk about hip pain and mobility. I don't know why, when I say hip, I always think of Elvis Presley. Why is that?
Was not on my mind.
No. I wonder if he had hip pain.
Good question.
So I want to let our listeners know that we have a different format. We were doing Health Freedom Updates, the first segment, and we'll be doing a whole show, so all 4 segments, at the end of every month.
Okay.
So I wanted to let our listeners know we did a show last week. So at the end of this month on our podcast and radio show, we'll have a whole show on our health freedom. We're actually going to have Leah Wilson with Stand for Health Freedom on that show to give us some updates. She'll be doing a segment. So wanted our listeners to know that. So let's talk about hip pain and mobility. So how many hip replacements are there a year, Dr. Prather?
There are 450,000 hip replacements a year, and it's growing by about 10% per year.
Wow.
So
that's a lot of hip replacements.
Yes. It wasn't too long ago. I think I had done one quite a while ago where I was saying about 10 years ago it was 250,000. So it's something that's going up and quite a pain in the hip.
So what is the number one cause of hip replacements?
The number one cause of hip replacements is osteoarthritis. So that's the big one that leads to most hip replacements.
Yeah, it seems like there's a lot of wear and tear also on the hips.
Yeah, the hip, of course, takes a lot of punishment along with the knee. The knee actually has more replacements than hips, about 650,000 a year.
So how many Americans have osteoarthritis, and what is osteoarthritis?
Well, there's about 40 million people out there right now, Americans, who have osteoarthritis. And interestingly enough, once you're over 50, 80% of everyone has osteoarthritis.
Over 50 years old.
Over 50 years old, 80% have osteoarthritis. It begins sooner in men, but once as you get older, women actually outnumber men on who has osteoarthritis.
And explain, what is osteoarthritis?
Well, osteoarthritis is wear and tear. Basically, it's a breakdown of the supporting tissue around it, the cartilage, where it starts to get degenerated. And there's a lot of reasons for that, for the osteoarthritis. A lot of it's inflammation. Poor nutrition actually plays a big role along those lines. Just bouncing up and down and injuries over time. So there's a lot of different types of causes. Your diet plays a huge role in that too.
Interesting. So what are the symptoms of osteoarthritis?
Well, one of the biggest things is pain. Though we've had people with severe osteoarthritis with no pain. What was showing up was lack of mobility. That's why pain and mobility is kind of considered along those lines. And it's something that, when you kind of get up and things kind of creak, or, you start to move. It's interesting because if you have an actual trauma to it, the more you use it, the more that it hurts. With osteoarthritis, it's the less that you use it, and then you try to move, the more pain it causes. So osteoarthritis is something that is helped by movement. Being sedentary actually leads to a lot of problems with osteoarthritis. So you have pain, lack of mobility, abnormal movement, and then you also have sort of some interesting sounds coming from you.
Interesting sound.
There's a story of my sister. She was a kindergarten teacher, and she was trying to teach the kids to do squats. And she said, now do exactly what I do as an exercise. And she went down and did it, came back up. And she said, okay, now your turn. And none of the kids did it. And she said, what's the problem? She said, one of the little girls said, well, teacher, we can do that, but we don't know how to make the noise with our knees like you do.
That's funny. Yeah, how do we make that noise? Oh, I know. I'm a grandma,
Yeah.
a 6 and a 4-year-old. And, it's interesting. I've been a grandma, 6 years now.
Yeah.
I'm getting up a little slower than I did 6 years ago. But I'm getting up and down.
I tell you, those grandkids can keep some mobility going.
They sure can.
I have gotten down on the ground a lot more than what I would have normally.
So are there other causes for hip pain, and what are they?
Yes, a very common type of thing is bursitis, which is more of an injury of the bursa and requires a whole different type of a treatment, but we do a very good job with that. There could be muscle injuries, there could be nerve impingements. In other words, there's quite a few different types of things that you need to look at to know. You need to know what you're treating first. Mm-hmm. As we say, we don't really come up with a treatment plan until we know what the problem is.
Right. There might be x-rays involved.
Yes.
We'll talk about that. So what is the disease care model for treating hip pain? We talk a lot about the disease care model, and then we're going to talk about what we do at Holistic Integration,
Sure.
Structure Function Model of Care. Well,
the disease care model is drugs. The preferred drug is NonSteroidal Anti-Inflammatory Drugs. There is a problem with using those. They do really, really help out with the pain, but they dissolve the cartilage.
Oh, really?
So, like myself, I'm actually, as I do my x-rays, I have no osteoarthritis in any of my joints.
That's good.
Which is really, really unusual for 66. But if I was to take non-steroidal anti-inflammatory drugs, over a period of time, I would actually start to get some degeneration. So the drugs speed up the degeneration and the osteoarthritis. They help temporarily, but they make the problem worse.
In the long run.
In the long run. A matter of fact, it actually starts to show up within 3 months of taking them.
So they help with the inflammation initially?
They help with the temporary relief, but they make the problem worse, which is one of the things I really try to talk to people. In other words, non-steroidal anti-inflammatory drugs are something that are fine if you're taking it within 2 to 3 weeks, and then you stop. You don't get a whole lot of damage along those lines. But anything that's a chronic type of problem, non-steroidal anti-inflammatory drugs don't work. They make the problem worse. So any type of long-term type of use along those lines is not good. The secondary thing that they do once it wears out and it's no longer functioning is that they do a hip replacement, which they've gotten much, much better at that than they used to. So the hip replacements have a high satisfaction rate, because people are much better. But if you have a hip replacement, you have a permanent disability. Because you're not going to be the same as if you had your own hip.
Right.
In other words, that is something that if things have not gone well and there's, basically everything's completely destroyed, then that's a good option. But you're not going to be as good as if you have your original hip. And all surgeons, orthopedic surgeons who do hip replacements, knee replacements, always say that if you can get it fixed without doing a replacement, you're better off. Because there's a reason why it gives a permanent whole body impairment if you have it done.
Yeah.
And there are risks. I mean, the risks are lower than what they used to be. You can get infections, you can get blood clots. There's about 4% of them that just make you worse. But the majority of them, knee replacements, hip replacements, they've improved dramatically. And most hip replacements will last about 20 years at this point.
Yeah. And when we come back, we're going to talk about the structure function care approach to the hip. So you can avoid hip replacements and have more mobility in the hips.
And even the surgeons say, if you can avoid it, do it.
All right. We'll be right back. Holistic Integration is excited to announce the launch of our very own dietary and herbal supplement line, Stasis Supplements. Stasis Supplements are created to maximize our patients' experience of true health by bringing mind, body, and spirit back into alignment. Learn more about Stasis Supplements on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip featuring rapid release technology. What professionals out there use the rapid release technology?
It was invented by a chiropractor, and chiropractors actually are really quite innovative and have come up with quite a few devices. So chiropractors obviously were the first ones to start using it. Physical therapists, occupational therapists, massage therapists are also using it. Athletic trainers,
The NFL,
NBA, NHL, PGA. So it's very important for sports. A lot of Olympic athletes are using that to maintain the function of their body. So for sports, for recovery, even after surgeries, headache clinics are using it.
I've even taken the softer head over someone's cranium and that back occiput area.
Sure.
And we have sutures in our skull and work the sutures with it. The headache people just love that.
You just see people kind of drifting off.
Uh-huh.
So during the treatment, if you're not careful, people are just going to fall asleep on you.
That's all right. TMJ, using that small head.
Yeah, temporomandibular joint syndrome can be very, very devastating to people. Getting that under control can really help out. One of the things that's very interesting is that we used it for people with depression even. One of the things that occurs with depression, pain can kind of kick that off. And then also the levator scapula. As you release that, then all of a sudden people can start breathing.
Those are up in the neck area, that upper back.
We call those the tension muscle headaches. Getting that release can actually change people's anxiety levels and decrease their depression levels.
Relax muscles and release aches, pains, and tension through Rapid Release's high-speed vibration therapy. Experience the benefits of rapid release therapy by scheduling an appointment at Holistic Integration. And to purchase your own, go to our website at thevoiceofhealthradio.com. Click on the Rapid Release banner and enter code PRATHER, P-R-A-T-H-E-R, for a $100 discount for the Voice of Health Radio listeners. Holistic Integration is proud to offer CBD products from Jace Clinical Solutions. There are tens of thousands of studies showing the benefits of CBD products. There is evidence showing CBD can help insomnia and improve both falling asleep and staying asleep. Studies show that CBD can be helpful for addictions by alleviating cravings for alcohol, opioids, stimulants, and cannabis. CBD has also shown promise for chronic pain patients. CBD has also shown great success with various forms of anxiety and has shown promising results with inflammation as well. Many of the CBD products you can purchase are simply not regulated like those from Jace Clinical Solutions. That's why we offer their CBD to our own patients at Holistic Integration. Go to thevoiceofhealthradio.com, click on the banner for Jace Clinical Solutions CBD, and enter the code PRATHER, P-R-A-T-H-E-R, to receive a 25% discount and learn more about how Jace Clinical Solutions CBD products can benefit you.
I feel good. I knew that I wouldn't. I feel good. I knew that I wouldn't. So good.
You're
So
listening
good.
to The Voice of Health with Dr. Robert Prather of Holistic Integration, the most comprehensive wellness center in the Midwest. Well, we're talking today about hip pain and mobility. We talked about the disease care model. And we're going to talk about the structure function model, which we do at Holistic Integration. Let's talk about what is structure function care and what can it do for hip pain.
Well, the structure function care has to do with homeostasis. Homeostasis is balance in the body. So if you're talking about structurally, and of course it makes sense with the hip pain, that you would want to get things balanced out structurally. Mm-hmm. And then also functionally. In other words, are you able to maintain your cartilage? Do you have the proper nutrients? Do you have the ability to keep inflammation out of there and degeneration? So it's the physiology of the body where you're keeping it balanced and also structurally keeping everything balanced. And as you do that, then you get the homeostasis, and homeostasis is the definition of health. So what you're doing is you're talking about maintaining your health and maintaining the health of your joints.
Mm-hmm. Very important.
Very important.
And even the hips being balanced and the pelvis and all that, and we're probably going to be talking about that.
Yeah, when you talk about the structural, it's a very critical type of thing of what you're actually working with.
So let's talk about what natural products work better than you were talking about the
Steroidal anti-inflammatories.
Yes. What natural products?
Well, one of the main thing is that there was a whole big thing way back where they used to promote chicken cartilage as something to help with joints. And basically Knox gelatin. You remember Knox gelatin? Knox gelatin was a medicine for joints that was put out. And basically it was a remedy along those lines where you got things into the system. And the main things that are in the cartilage is glucosamine and chondroitin was what they found that actually worked. And so Harvard Medical University actually said, okay, you've been saying all this time and you've been really hit by the drug companies and the FDA for actually promoting that and claiming that it helps with joints. Let's do a study on it. And they did the study, and they were absolutely amazed at how much better it worked than the drugs. And so they said, well, what is it in there that actually works? And so they went in there and actually found glucosamine and chondroitin were the two things that really made the joints work. And really, it's glucosamine is what they found that really works quite well. And what it does is it delivers sulfur and some other different types of aspects to the joint, which helps the joint to reproduce. So it actually keeps the cartilage up. And it can even repair damaged cartilage. So glucosamine is sort of like a basic type of thing that actually kills non-steroidal anti-inflammatories as working on joints because it takes down the inflammation. And then the longer you take it, the more it works. I had a gentleman who came in, and it's actually a combination. It's called pro-trauma. He had been on non-steroidal anti-inflammatories and was a runner for years and years, which isn't a good idea. So I went through the whole thing with the non-steroidal anti-inflammatories, told him how bad they were and what they were doing to him, and actually he says, they're not working. I keep on upping them. And I said, they're making things worse. And I said, try this.
The pro-trauma, which we carry at Holistic Integration.
And he said, okay. And he comes back and he says, it works better. And he got treatments, got things, and he still orders it on a regular basis. We haven't seen him because he hasn't had problems with his joints.
What is in that pro-trauma?
Well, it's got quite a few different types of, it's got herbals, nutrients, and then also has the glucosamine product in there. So it's a combination of things. And then that actually will turn around the whole joint, and the combination on that works extremely well.
Yeah.
And we found that on quite a few bases, as far as people with osteoarthritis. As we go with the natural things, it works much better. Another thing we use is hyaluronic acid. It's the material that goes in between the joints. It's used for some other things. But hyaluronic acid has been proven to be a very, very good product. Now, one of the things that we do is we have actually about 25 different products that we can give for joints and osteoarthritis. So we have a lot of choices. Pro-trauma seems to be the one that works most often.
For people.
But some people, we have some other things that actually work along those lines. So we actually test that out and find out which one's going to work the best for you.
Right. So
and we pretty much have found that the natural things always work better than the pharmaceutical.
And like you said, what it's doing, it's not destroying. It's helping build up that joint.
Yes, it actually heals the joint. So long term, you get better. Whereas if you're doing the drugs work. But you only should use them like if you've got an injury and then you use it for a short period of time while that injury works. It's fantastic for that.
Short term, yeah.
For osteoarthritis, long-term type of care, it is the worst thing you could possibly do.
Okay. Well, let's talk about vitamins. What vitamins are important for joint health?
One of the most important things are the B vitamins that they found. So vitamin B3 is extremely important. They have actually done clinical studies along those lines and found that it can really turn around joints. But the whole B vitamin complex is actually extremely important for the joints. Vitamin A, vitamin E, vitamin K are also critically important for the joints. One of the most important vitamins is vitamin C. Because vitamin C is absolutely critical for the body to be able to replenish and renew the joints. So vitamin C is another thing that has great anti-inflammatory type of properties to it. And then also it has a tremendous amount of ability to regenerate the joint too. So vitamin C is also an amazing product for joint health and joint repair.
Mm. And what about minerals?
Minerals are very important too. Zinc, copper, calcium, magnesium, all are very, very critical. As a matter of fact, copper is probably one of the most important things for joint health. Have you ever heard about people wearing like a copper bracelet for arthritis, especially for rheumatoid arthritis? Because what it does is it helps to heal the joints. Because one of the things that seems to happen with rheumatoid arthritis is the copper seems to get depleted. And so wearing a copper bracelet along those lines, the body absorbs the copper in through the skin. And then you actually get the copper to actually get things back up to normal.
And then we have copper
We have copper that we give, and
form.
it's a very good form along those lines. One of the things that is a great way to get copper into the system, because copper can actually be a little difficult, is bee pollen. Bee pollen is one of the things we use to get copper into the system. It seems to be very high in that. So, we find all the different ways to supply those products into people's health and well-being.
So we've talked about natural products, vitamins, minerals. What about herbals?
Herbals are extremely important. One of the things you want to do is to be able to work on free radicals. And there are some excellent types of products, herbal products, that can help with that. If you're looking at along those lines, pine bark actually helps out quite a bit. Grapeseed extract helps a lot with free radical pathology. So those are different ways to actually help. One of the other things is something called boswellia.
And I know we carry that.
Yes, boswellia is absolutely a wonderful herbal for helping out with joint health and joint inflammation. Curcumin does extremely well with joints, and you can really, some people it's just like magic with them. So that's a good product to test out and see if that helps out too. Garlic actually helps out, and ginger. Ginger is also another product that helps out with joint health. So again, there's about 20 different herbals that you can use that can be helpful for joints.
And I know in the last segment, we're going to talk about the diagnostics so that helps you be specific, like,
which one what thing are we actually going to use?
Right. And it's more of
it's not really a guessing game. We kind of know after we do the testing.
All right. When we come back, we're going to talk about more of the holistic treatment for hip pain and mobility. We'll be right back. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I do love the vegetarians. I always get a kick out of it when they try and impress you. They're like, I haven't had meat in 5 years. I haven't had a banana in a month. That's me bragging about it. Do you know what they do to those chickens? No, but it's delicious. Don't get me wrong, I love animals. I just love to eat them more. Fun to pet, better to chew.
The Voice of Health Wellness Tip featuring Jace Clinical Solutions, the most trusted CBD brand. So why do most people use CBD products?
The big reason that people mainly use that is for anxiety and stress, and then also for sleep were the big things. Men also used it quite a bit for pain and muscle aches. Older people tend to use that for arthritic pain. One of the things that CBD does naturally within your body is regulate those things. So there is a natural component along those lines to actually help to work along those points. Those are the main things that people are thinking about, but there is a tremendous amount more that CBD can do for you.
I heard the word regulator. It's a regulator.
Yes, that's the big thing that CBD is designed to do. And all of its actions are positive. Now, when you get into THC, there's actually a lot of negatives that go along with that. It can actually destroy your natural receptors so that it can actually cause problems, whereas the CBD only seems to have positive effects. THC has a lot of negative effects over a period of time.
Well, what is the research showing for future uses of CBD?
They found that there is a possibility that CBD actually helps with lung cancer,
Wow.
which is interesting. We don't know if there's any other forms of cancer. They also found for ADD, ADHD, that there's excellent results. And then also for different forms of epilepsy, especially in children, there's a decrease of all sorts of different things that are occurring along those lines.
Go to thevoiceofhealthradio.com, click on the banner for Jace Clinical Solutions CBD products, and enter the code Prather, Prather, to receive a 25% discount on CBD products you can trust. Are you experiencing muscle pain or tightness anywhere on your body? Try the Rapid Release Therapy Cordless Pro 3. The Cordless Pro 3 is a targeted high-speed vibration therapy device used by medical professionals to quickly relieve a wide variety of aches and pains. After years of development, the Rapid Release Therapy Cordless Pro 3 is the latest in rapid release technology. It's more powerful, quieter, and lightweight with a long battery life, and best of all, it's cordless. Safe, effective, and easy to use, this professional quality medical device has 5 built-in heads, giving you the versatility to treat small bony surfaces, such as fingers, wrists, and ankles, and powerful enough to quickly relax the tightest hips on professional athletes. Unlike the low-speed percussive devices, rapid release therapy delivers for sensitive areas like joints, neck, and ankles safely and comfortably, and provides the raw power your larger muscle groups need. Go to our website at thevoiceofhealthradio.com, click on the Rapid Release banner, and enter code Prather, Prather, for a $100 discount for the Voice of Health Radio listeners.
Doctor, doctor, give me the news. I got a bad case of loving you. No pill's gonna kill my head. I got a
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of Holistic Integration, where we get to the root cause of your health issue. Well, we're talking today about hip pain and mobility. We do at Holistic Integration, structure function care. Kind of talked about the functional part of treatment in the treatment of the hip. Let's talk about the structure part now. Why is a balanced structure critical for hip pain and mobility?
Well, if things are out of balance, you're going to see the body's not going to work as it should. So there is a perfect position for the hips and the rest of the body, and the whole body will influence the positioning of the hips. One of the things that is a permanent disability is if you have a leg length discrepancy, because you're going to start to develop, especially with that, hip problems. And if your pelvis is off, if things are not aligned. And as we check people's leg lengths, about 80% of the people, if they're laying down on their back, there's a discrepancy between one leg and another. Not that necessarily that it's a very small percentage of people who have a difference in actual leg length, but it's acting like that. And if it's acting like that, you're going to get the same effects.
You said 80%.
80% of everyone, as they have done studies on that, have some type of leg length discrepancy as you're checking them supine or prone. And that's going to wear out your hips.
Right.
If you get that balanced out, the distribution on there, it's a dramatic difference as far as on how much pressure is on the hip, and things are balanced, and the body actually has a chance to heal, and it won't degenerate further. So getting that all aligned, and of course, what is the best thing for that? Chiropractic. Yeah, that's what they do, is they line that up. Now, of course, it's not just the chiropractic on that. You have to do other things, to make sure that it stays like that.
Right.
But as everyone that we have that we do a chiropractic adjustment on, the leg length balance has to be there before we let them out the door. And the pelvis has to be balanced. And oftentimes as they go out, that pelvis is imbalanced, leg length is off. And as we get that corrected, it's amazing how much pressure. The amount of pressure is that as you have an imbalance along those lines, doesn't just add, it multiplies. So you get a multiplication of pressure on the hip if things are imbalanced.
Yeah, it makes sense.
Yeah.
I mean, your car needs an alignment.
Right.
Right? The tires can start showing if there's a misalignment.
Yes. Matter of fact, a lot of times when people are having trouble with knee or hip replacements, it's because there's an imbalance going on. We do some adjustments on people, and it's like, oh, now it's working.
Right, and so you can adjust after a hip replacement.
Oh, as a matter of fact, yeah, we encouraged everyone who's had a hip replacement to come in and should get treated just to make sure that the hip replacement goes well.
Right.
We've made a lot of difference. I had one gentleman who, it was a year after his hip replacement, and he was saying, it's just not working. It looks like I'm going to be in the 4% where I need to have a replacement.
Another replacement.
A replacement. The doctors looked at it and said, I don't know what's wrong, but, we can go in there and work with it because it's obviously not working. So we checked him out, and there was a huge discrepancy in his hip alignment. So we brought that back into place, did some acupuncture, some rehab, and, the orthopod actually called me and said, thank you. I did not want to go back in there. They're fixed. They're happy with everything. This worked out really well.
Yeah, so if you're out there, you've had a hip replacement, it's important to get that treatment.
Well, it's traumatic, and you need to have some good rehab on it, something like that. And it's so much more helpful. You were in occupational therapy, did the rehab. How does it work with chiropractic?
Oh, it's amazing. It just helps in their rehab because things are aligned.
Right.
And you're not having to fight all the muscle spasms that go along with that as much. It just makes our job in rehab so much easier.
The corrective exercises just go so much easier. It's just a hand and glove type of thing.
Right.
So like the three basic things that we do is the chiropractic, in the physical, the corrective exercises, the acupuncture and dry needling helps out with that, and then also the therapeutic instruments.
Yeah.
So putting all
that
those
was
together.
5 things.
Fourth. Yeah. And I was thinking of the three major things: acupuncture, corrective exercises,
and we
but I
didn't even
wanna
talk
leave out the
about
others.
decompression, and we're going to talk about that.
Yeah.
Because that's been really helpful.
That's amazing stuff.
For myself, and we'll get to that. But why is a normal gait important to a healthy hip joint?
Well, one of the things that we like to do is have people just walk. And as we're observing them, and there's an abnormal gait along those lines, things aren't going to work. And oftentimes it starts with the feet. So we do orthotics.
Right.
The orthotics have been something that really can make a difference on the gait, especially because if your foot's not hitting right and it's off, then the whole gait starts to change, and it puts a lot of wear and tear on the hip joint. So looking at the gait is extremely important. There's a lot of different types of things, but the basic where it really starts is usually with orthotics.
Yeah, we see a lot of pronation,
Right.
Which will affect the hip. And sometimes it's coming from the hip, sometimes the feet.
Right,
and,
right.
Yeah.
You need to really take it as a holistic type of thing to get things balanced out.
Well, let's talk about acupuncture. What role does acupuncture and dry needling play in hip pain? And at Holistic Integration, we do both.
We do both.
Acupuncture and dry needling. And we're going to have a show on just dry needling later this month.
Yes, excellent. The acupuncture really helps with the healing. What it does is it actually brings in the electromagnetic energy of the earth into the system. So, when you're talking about like scar tissue, and and healing after surgery. So if you have a surgical cut and you use acupuncture afterwards on a regular basis, the cut will actually heal twice as fast, and it will heal without a scar. If you have an old scar, I had a gentleman who had a emergency abdominal surgery, and he had to go into the hospital twice with small bowel blockage because the scar tissue from the surgery had actually gotten around it and strangled the small intestine. And it was actually raised up almost a half an inch purple, where the scar was. And I said, we need to get rid of that scar. And I started doing acupuncture on it. And right now he has absolutely no scar. Now he has no hair where the scar was.
Yeah, but went from ugly to pretty.
And absolutely no problems with the bowels. So it's amazing, and it works on after breast surgery, after any of those types of surgeries. It just kind of clears out the scar.
Well, to me, it's one of the best anti-inflammatories.
And yes, I mean, you can have a swollen knee, swollen hip, swollen back. Yeah, and I've had people come in and watch it, and you put the needles in, and I sit there, and 5 minutes later, I tell the other person, look at, and they say, oh my gosh, the swelling's almost gone. Swelling goes down almost immediately. Now, as you're doing dry needling, what you're doing is getting in there and going after the trigger points. Is basically what you're trying to do to get those relieved. But all those things really make a big difference in any type of pain or disability that people are having in any type of joint.
Yeah.
So the acupuncture dry needling is a great adjunct to all this.
Well, let's talk about one of my favorites, decompression.
Oh, yeah.
What is it, and how can it help people with hip joint?
Well, basically what you're doing, it's not a traction where you're actually pulling on it. I try to help people to understand that.
Right.
It's actually a pumping of the joint. And as you pump the joint, you're trying to pump in nutrients, because oftentimes the joint doesn't have a blood supply.
Or get it
directly to
hydrated
it,
too.
and gets the hydration going. And as you do, basically the joint, that's why movement helps out osteoarthritis, because the more that you use it, that pumping action, then the fluid gets in there and you get healing going and the nutrients into it. So with that pumping, you're encouraging the nutrition, the nutrients to get into the joint, that can then the body can use that to help to heal it.
Right.
Your example.
Oh yeah, for my knee. So I can have knee issues, and one of the treatments had adjustment and the decompression with my knee, and after 2 sessions the pain went away.
Right.
Yeah.
We've had a lot of people who were scheduled for knee surgery, hip surgery, and was canceled because of the decompression.
Well, I can think of when I was in there doing rehab. Now we have someone else in there, but he was in his 40s, and he had just destroyed his hip. He was a runner.
Right.
And they were telling him it's bone on bone and he's going to need a hip replacement. So he came in to see us to see if we could do anything. And he was on a treatment plan with these modalities we're talking about. The decompression he got on, and he was able to avoid the hip replacement.
Yeah.
And the pain is gone. And it's just really exciting because this is a young man in his 40s.
Right. Yeah. You don't want to, definitely if you can avoid it, especially under the age of 50, they really try to find some other way to do it, and still doing well.
Yeah. So we talk about the chiropractic, acupuncture, decompression. What therapies are helpful for the hips?
We have quite a few. We have ultrasound, we have electrical stim, we have diathermy that increases the blood flow. All those different types of modalities. We have rapid release.
Yes.
Which is absolutely wonderful for trigger points. It's people who get that done are like, whoa, this is This is amazing. We've had one guy who had leg problems, and hip problems. And the rapid release, where we were going over it on his leg, he actually bought one.
Yeah.
Because it was just like he was going to be moving to California, and he says, I'm not quite sure if I want to make sure that I've got that treatment on a regular basis, because he said it was just like a miracle for him.
Yeah.
So having those different modalities along those lines that we can offer, in other words, about everything that you could do in structure function, we do.
Yeah. What's nice too on those rapid releases, we have 2 that we keep in the office that we can sell.
Oh yeah.
Immediately, people, because they love that rapid release.
One of the most popular treatments.
All right. When we come back, more on hip pain and mobility. We'll be right back. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip featuring Natrum Naturals, goodness in a gumdrop.
Hello, friends. This is Kira, your functional health coach and master herbalist. So in the spirit of anti-aging, let's talk a little bit about collagen. When we hit the age of 25, our body's natural collagen production starts to decline, and this process actually continues to speed up every year. This decline in collagen is what leads to the physical signs of aging, like fine lines, wrinkles, sagging skin, when hair starts to thin, nails get brittle, joints feel weaker. So taking collagen in the form of a powder is a super hot thing right now. And there can be a lot of benefits in terms of improving gut and joint health and maybe influence the skin and the hair a little bit, but there's still a lack of research. So we don't quite know if it works or how it works. So there's also a lot of contamination with collagen powders on the market with heavy metals because they're utilized in the process of hydrolyzing the collagen, which makes it more absorbable. And most of the collagen that you find on the market is going to be hydrolyzed because when it's not, then you're actually at risk for not absorbing it. So it's a bit of a catch-22. The good news is that we do know how to improve our body's innate ability to create its own collagen. We understand what the specific building blocks for collagen are, so certain amino acids like glycine and lysine, and then vitamin C, a necessary cofactor for collagen formation. And then we add this together with healthful ingredients like antioxidants and minerals that support healthy skin, hair, nails, joints, and the gut. And then we come up with the vegan collagen boost product from Natrum Naturals. So instead of the typical animal-based collagen powder that also has the potential to be contaminated with heavy metals, we have this product that is completely made out of plants, and it supports the body's production of collagen without having to take all these powders. So we package it in a awesome gummy form that tastes delicious, but it's also incredible for your health.
You can find the gummies at natrumnaturals.com and use the exclusive code Voice of Health, no spaces, Voice of Health, for 20% off orders of $75 or more. Natrum Naturals from Holistic Integration, goodness in a gumdrop. Since 1893, the Wheeler Mission has been ministering to the homeless, poor, and needy in central Indiana. This month alone, they are planning to provide almost 27,000 meals. Their monthly shopping list includes 100 turkeys, 100 hams, 600 cans of green beans, corn, and sweet potatoes, 100 cans of coffee, and 100 pounds of sugar, and lots of individual cookies, bags of potato chips, bottles of water, as well as napkins and disposable cutlery. The Wheeler Mission Pantry empties fast these days, and they could use your help restocking their shelves. You can help by bringing canned goods and non-perishable food to the Wheeler Mission, or you can make a gift today on their website at wheelermission.org. Your gift not only helps with their shopping list, but fills the lives of hurting men and women with new hope through food, shelter, care, and God's love. Learn more about the work of the Wheeler Mission and how you can help by visiting their website at wheelermission.org. You're listening to The Voice of Health with Dr. Robert Prather of Holistic Integration, where our mission is restoring hope to our patients. Well, we're talking today about hip pain and mobility. You know, one thing, I learned this before I get out of bed. There's a couple things that I do is I pump my ankles, to get the mobility, and the ankles get the blood flow circulation going in my body, especially in the calves, loosen them up, and I rotate the ankles. And then I bend my knees and rotate my hips, back and forth 10 times each side. And that just really helps kind of warm things up before I get out of bed and get that circulation going and movement going. So that's something, as long as I don't have to run out and go to the bathroom first. Doing better on that lately.
Yeah, good.
Okay. Let's talk about liniments too. What are liniments, and should they be used for hip pain?
Liniments are highly recommended for hip problems, and oftentimes most recommendations are kind of like standard on what they use, but we actually have a tremendous number of liniments.
Yeah.
One of the things is that we use Chinese liniments from the Shaolin Temple that have been around for a couple thousand years.
Yeah.
And we have 5 different kinds of liniments along those lines.
One's called Dragon Blood.
Yeah. Mark Sebastian, Shaolin Di Jia Jiao. And then, of course, we have some of the more standard types of ones that are more popular, but we've got about 8 different liniments that we can test out and find out which one works. And oftentimes, as someone puts it on there, they go, "Oh, pain is gone."
Yeah.
So liniments are an important type of a way, whether medical doctors actually recommend that too. So liniments, and they're herbal based, and it's again finding out exactly which kind works the best for you. Once we apply it, the person usually confirms that, yes, that works. And then we send it home with them so that they can actually use it on their own whenever things kind of flare up.
The other thing I was just thinking about is our new product, the Collagen Gummies through Natrum Naturals.
Oh, yeah. The Collagen, the gummies are great for osteoarthritis.
Yeah.
So I highly recommend that one, too.
Yeah, I take the 2 gummies a day. It's been really helpful.
Right.
And it helps, hair and skin, too.
Yes, it does. It's anti-aging.
So when should someone see a doctor for their hip?
Well, if you're having some problems with the hip, and it's not just an acute type of situation, usually if it lasts more than 4 weeks, I say you should probably go to a doctor. And get it checked out and see what's actually happening. So then you can have an idea on again, prevention is the best type of way. Really, everyone should see a structure function doctor who thoroughly looks at you from top to bottom.
Yeah.
That's one thing that we do at our office, so that we've actually picked up on people that they were starting to develop osteoarthritis in their hip joint. Before they ever had any idea that was happening. And then prevention works the best.
That's called prevention.
Right. So getting it checked, but if you're having pains along those lines, and it seems to be something that you've had more than 4 weeks, definitely you have to see a doctor for that.
So what should the exam for the hip entail, and what do we do at Holistic Integration?
Well, you need to have a good physical exam. One of the things is people are always impressed with our examination in our office. Just because I can usually get in there and tell you probably what it is before we even get started.
Yeah.
Most of the patients who come in say, well, I learned more. I've been to 8 different doctors, and I've learned more in 15 minutes than anything else. So the examination has to be really good, really know what's going on, and if it's a good examiner, they should be able to give you a pretty good idea of what's happening. Then, of course, we confirm. We also go on from there, lab tests, imaging, all those types of things.
Yeah, let's talk about why is imaging critical for the evaluation of the hip?
Well, the best, most accurate way to determine for disability for a hip is X-ray. X-ray tells you more than about anything else on what's going on with the hip and how bad it is. So getting some imaging along those lines, if you're looking at hard tissue, of course, CTs and X-rays are the best. Usually start with an X-ray. MRI, more for soft tissue, and ultrasound are the ways that we evaluate soft tissue imaging. But looking at those things and being very thorough along those lines to find out if you don't know, the treatments usually don't go well. And if you do know, usually you're going to have pretty good success.
And I like how we do things at Holistic Integration because we have a treatment plan, but it's flexible enough if we need to tweak it, if we're finding something's working better than another.
Right.
It's
Everyone's different.
We're not going to, if we're not seeing progress in a short amount of time, me, I'm
Right.
like, okay, we should be.
In 2 weeks, we should see definite progress on a hip.
Yeah. And pain levels going down.
Otherwise, we go back to the diagnostics.
Yeah.
We miss something.
Yeah. So why is blood work important? We're talking about a structural issue. So
Sure.
why is blood work important?
Well, I mean, one of the things that nutritionally is the liver. Surprisingly, if the liver's all backed up or inflamed, it contributes to hip pain. If you have chronic infections, one of the things that is the hips are if the lymphatic system is all backed up, if there's toxins flowing through the system, it's going to degenerate the hips. So finding out what's going on internally, if there's a high inflammatory process, if there's some autoimmune diseases going on, rheumatoid arthritis, we need to know that because that changes the whole treatment plan. So blood work is absolutely critical along those lines to find out what's happening. Also, with blood work, we can even find out, like let's say we determine it's really a B vitamin balance that really needs to be worked on. Well, we can do blood tests to find out what is it that we need to do exactly.
Yeah.
With a
and we
vitamin.
have a NutriVal
Yes.
that checks every nutrient in the body.
Right.
Yeah, and then we talked about copper. So what role does the hair analysis play?
Hair analysis shows tissue minerals, and that is absolutely critical to know because if there's a deficiency or heavy metals along those lines, that's going to affect the hip, and you're never going to make progress unless you get that right.
Yeah, diagnostics are so important. And then gut health.
Gut health. Well, we talked about the lymphatic tissue. If you have a lot of infections or problems in the gut, it's all going to drain down into the hips. It's almost like a poison goes into the hips and it actually eats up the joints. It's one of the things I say. So most people who have gut issues or gut infections, their hips start to degenerate. So getting that cleared up oftentimes will fix the hips.
All right. Very informative. Thank you, Dr. Prather.
Thank you.
Holistic Integration is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.